Ladies and gents, welcome back. Our medical system in Canada is broken, and experts are saying that it was already stretched as thin as possible before the pandemic hit us. And well, we're still in a situation where we're not hiring back medical professionals and nurses that abstained from taking the COVID-19 vaccine. Here we are from CBC News. More money is a must, but healthcare delivery also needs a major rethink, doctors say. Doctors say the pandemic broke a healthcare system already functioning at full capacity. As the premiers and the federal government continue to battle over healthcare funding, leading doctors and experts say that while more government money is needed, the way healthcare is delivered in Canada also needs to change. One thing I didn't know recently until I talked to Dr. Brian Day was that hospitals are actually paid outright. They're paid all the money they're going to get at the beginning of the year, and any patient that comes in, none of the procedures are earmarked to payments that they receive. No. They're all just an expense now. Every patient that walks into a hospital is an expense to the hospital. That is a disincentive for the hospitals to even provide the service, in my opinion. The issue is dominating the national conversation now as patients find themselves let down by a shortage of doctors and nurses, overwhelmed by pediatric hospitals and a backlog in necessary but elective surgeries. The Children's Hospital of Eastern Ontario, the CHEO for short, recently had to accept staffing help from the Canadian Red Cross as it struggles with a surge in hospitalizations caused by respiratory viruses like influenza, RSV, and COVID-19. Alex Munter, the CHEO's CEO, said the hospital had just experienced its busiest May, June, July, September, October, and November in its 50-year history. Now, of course, Bonnie Henry over here in British Columbia, having no tolerance, no sympathy whatsoever for people, well, that did not partake in the vaccination effort. Some people abstained from it, and this should be their choice. But she's showing here in a public statement how she has no tolerance. She has very little patience for people who aren't immunized in healthcare, she says here.
First, we need to give everybody the opportunity to be immunized. That is really important in healthcare, and I have very little patience for people who aren't immunized in healthcare, and that will be, we've had a vaccinator mask policy for influenza. We will have a very similar policy that if people choose not to be immunized and you work in healthcare, then you will not be able to work in certain settings without taking additional measures. There will be consequences for that decision.
So what she doesn't actually state in this is that there was a vax or mask mandate when it came to influenza in previous years. But what she's not divulging, what she's not getting into, is the fact that they got sued over this, and the unions actually won. The restrictions were actually lifted from these nurses and practitioners at the time, because of the lawsuit, saying that these aren't things that they can be pushed on them, and that the science wasn't there for it. They didn't have the science backing up the policy that say that with influenza, that if it could be spread regardless of if it could be, if it was transmissible regardless of inoculation, as well as the masks not doing what they're supposed to do, well, there's no point to it. And so they lost this case, and that wasn't upheld. So yeah, that's her telling us that, well, there was a policy, but that the policy wasn't upheld. So why should we uphold this policy? Now, David Eby is the Premier of British Columbia, and he's been making public statements saying about just how much he's going to help out practitioners that want to come back to work.
I'm pleased to announce new supports in a faster assessment pathway that will get more nurses working in BC's healthcare system faster. For nurses returning to practice, there will be help with the costs of re-entering the workforce. These are nurses who may have taken a break for practice for any number of reasons,
number of
and want to come back but are facing financial or other barriers to coming back, we want to support them in coming back to work. This includes application and assessment fee support, along with travel expenses support. Additionally, bursaries of up to $10,000 available for any additional education that those nurses need who are coming back to practice in order to be able to get to work. For internationally trained nurses, we committed $1.3 million to set up a new pathway.
What? What? Okay. Nurses, are you still fired?
Hi there. Yep, still fired.
Yep, I'm still fired.
Yep, I'm still fired from Interior Health, and I'm cleaning people's houses for cash.
I am still fired.
Yep, still fired.
Yes, still fired.
Hey, yeah, I'm still terminated. Starting work in Alberta next week.
Registered nurse, BC born and raised. While BC remains in a healthcare crisis and hospitals and emergency departments are closed, thousands of us ready, willing, and able to work remain fired and looking for employment in other provinces.
My name's Vera. I'm a veteran RN of 27 years with a passion for geriatrics. I was terminated from Interior Health in November of 2021. I'm now in 2023 moving to Alberta where I've had multiple job offers.
January 16th, 2023, going for a walk on the lake, the beautiful Arrow Lake. Yeah, this is my home province. Born and raised, BC girl. Kids born here. Love it. Mountains, fresh air, lakes, rivers, everything. It's my kind of place. Can't work here. Registered nurse in BC. Haven't been able to work for over a year now. You're forgetting about us, province. Your healthcare is failing you. And you have thousands of nurses walking on a beach wishing they could be working in their province. Instead, we're planning on going to Saskatchewan. I've been to Alberta half a dozen times. Never been to Saskatchewan, but I'm going to go work there. This is my province. I want to be here. I want to help the people here. This is my province.
This is the unbelievable truth about the situation, is that the government is, well, they're not letting back unvaccinated nurses that they fired, but they're actually allowing other nurses, those same nurses, to go to other provinces where there's restrictions on other provinces in different ways. And it's just unbelievable the bureaucratic red tape that everyone has been put under this, and it's nonsensical. So we have nurses that are practitioners in British Columbia that are leaving the province to go practice in other provinces. Why can't they help the people in their own communities? Now, that video was put together by Corinne Mori. She joined me for a conversation, which will be premiering tonight at 9 Eastern time. That's 6 p.m. Pacific. Come check that out. An amazing 3-hour conversation with Corinne Mori. She's one of the fired nurses. She encouraged me to, if anybody wants to contact her, to give her Facebook profile link out there. You can contact her that way. If you are a nurse, or if you have or a person who has information or wants to get information from her, you can contact there. But there's also a website here to put out here, and this is BC Nurses Fight Mandates. Now, don't think that this is just BC alone. Across Canada, we're fighting these mandates as well. And it's funny because we've been fighting these mandates. The whole Freedom Convoy, everything was about fighting mandates, but these mandates are still in place for so many people. Who are we? We are BC nurses who believe in patient autonomy, freedom of choice, and informed consent without coercion and privacy in all medical decisions. We come from all areas of our province, both vaccinated and unvaccinated, employed and terminated, but we have the same common purpose. We oppose the public health orders, mandates, and the overreaching authoritarian measures instituted by our BC government. And I'm sure there's respective organizations again across Canada, but here we have it. British Columbia, there's a petition now to seek the recall of Premier David Eby, who has passed a piece of legislation that's gonna, well, I mean, I don't know a better word, but ruin healthcare in British Columbia by putting more power in the hands of unelected bureaucrats, but government officials, not medical professionals in British Columbia. And well, it looks like they want to get rid of them here in British Columbia. But I'll leave links for all of this in the description down below. You can check it out for yourself. And to keep this video short, I'll put it here, but I'll pose the question to you now. What is it? What is your situation? Are you still suffering, living under these mandates that are going on? And what kind of situation have you seen with our healthcare system? Whether you're in BC or somewhere else in the country, what does the healthcare system look like for you? Have you been able to get any sort of treatment for the things, well, and of course the important screenings and surgeries that have been delayed beyond the pale? Anyway, leave a comment in the comment section down below. Let me know what you think, and we'll see you in the next one. And we'll see you tonight in the premiere, where it'll be a live premiere at 9 p.m. 9 p.m. Eastern, 6 p.m. Pacific. Check that out. There'll be a live chat as it's going on. Check it out. If you can't catch that, the video will be up after that time. We'll see you in the next one. Keep on trucking.